From our perspective, looks at the lives and behaviors of millennials, Generation Z, and the changes that are happening in our 21st century and the innovators that are making it happen. We will explore trends, technology, music, fashion, social media, business, science, the arts, faith, and lifestyle. We would look at their interests, how are they changing our 21st century, and what is causing market disruptions, and what does that mean? From our perspective, it's not just another talk show. There will be roving reporters from the Caribbean, Europe, and North America. This will be a show of learning, exploring, questioning, listening, and creative ideas. So come join us on Comcast, Verizon, and online. As the founder of 21st Century Innovators, a program of which launched in 2015, I am motivated to see the youth strive and develop as successful leaders in this technology-driven global society. Unfortunately, not all great-minded youth have this opportunity, and it is my endeavor to see a level playing field so that all who wish to play or who are not aware that a game exists are given the opportunity to participate. From our perspective, is a media platform designed to provide opportunities for creative and innovative minds to gain exposure for their endeavors. In 2018, From Our Perspective ran its first cable TV episode. In the summer of 2019, and 6 episodes later, Season 2 aired. With each new episode, we strive to bring new and different content from around the world. We observe real-life issues and events, while at the same time providing new outlooks, opportunities, and solutions in upcoming episodes. We will meet individuals from the Caribbean, Europe, and North America who are creating great strides in developing successful leaders and implementing creative solutions that are bringing about change in their region. As e-commerce sweeps the globe, retail stores all over are looking to technology to help them compete in this digital world. We are going to look at a supermarket in Tokyo which has introduced smart shopping carts that allow shoppers to ring up their items as they shop.
This large supermarket is located about 40 kilometers outside of Tokyo. In July of 2020, it set out to increase efficiency and improve customer service by introducing an AI-based self-checkout system. The star of the show is the company's own tablet-equipped smart cart. After scanning a prepaid smart card, shoppers are ready to hit the aisles. Then they simply ring up items as they shop. A built-in barcode reader is used to scan items before they're put in the cart. When they're finished, they simply press a checkout button and head for a quick gate, which finalizes their purchase and quickly prints out a receipt. Leaving this simple task to the shoppers has allowed the store to cut back on the number of registers it needs, resulting in better efficiency and lower labor costs. And what do shoppers think of the new system?
Checkout is much smoother, and I can avoid close contact with others, so I really appreciate it.
The tablet not only shows the tax-included price of each item scanned, It also displays the total price of all items purchased.
I really like being able to see what my total is while shopping, because it can help me not to overspend.
I'm 85 years old. Once you use it a bit, it's not that hard. The system not only aims to make the shopping experience better, it was also designed to increase sales. The smart cart connects to an AI system and shares the shopper's past and present shopping data. After analyzing the customer's purchase history, it sends personalized product recommendations to the smart cart. The 4,800 square meters supermarket's AI system also makes use of 700 ceiling-mounted cameras. These eyes in the sky help reduce the number of staff needed to keep the store running smoothly. The system analyzes customer purchasing behavior as well as monitors shelves and displays to ensure that products never run out of stock. In addition, it even makes recommendations on product placement to improve the shopping experience for customers and to increase sales.
Running out of product is one of the worst things that can happen. By having digital eyes everywhere, we can increase productivity and offer better service.
From this clip, we observed that shoppers found the smart shopping cart experience easy, convenient, and efficient. The system allowed shoppers to avoid checkout lines. The built-in AI system provided valuable shopping data to management. It analyzed shoppers' behavior, thus providing management with key information as to when to restock certain items and where to place items in the store for better shopping experience and thus increase in sales. Let's now look at the use of digital avatar in the areas of marketing, sales, and customer service. This system also uses artificial intelligence to analyze client responses in order to improve overall customer service.
The avatar is being controlled by an employee working in an office located about 30 kilometers away. The service representatives can respond to a customer's reactions by selecting from a menu that offers a variety of facial expressions and other actions. For example, the avatar can even nod, shake its head, give a look of concern, show that it is thinking about something, and laugh. These little touches can help the customer feel more at ease. Since the customer can only see the avatar, service representatives can easily consult a manual or look up information to provide the best solution possible.
I feel I'm actually able to get along better with customers when using an avatar and provide them with even better support.
The current avatar trial is using one customer service representative to cover 3 different shops located throughout Tokyo. Avatars can be customized in a variety of ways. Company uniforms can be created, and skin, hair, and eye color can be changed with the click of a button. As we've learned from the pandemic, people are willing to work remotely. I think this avatar system can add a new level of possibilities to customer service jobs, as the employee's age, location, or gender don't matter.
The use of avatars to assist buyers in their shopping experience has its advantages. Individuals feel less intimidated to talk to an avatar image than a human. Even though the avatar is a real human, the intimidation factor is taken away. In addition, as mentioned by the CEO, due to the pandemic, people enjoy conversing with an avatar in the comfort of their home. In addition, avatars are opening up a whole new job market. It does not matter the age or gender of the person or even where they live. You can apply for the job of an avatar from anywhere in the world. At 28 years of age, After becoming disillusioned with the world of fashion photography, Cameron James Wilson quit to follow his passion of drawing and creating characters. He learned 3D drawing from YouTube tutorials. Using a program called DAZ 3D, he created the character Shudu in spring 2017. Since then, model Shudu has been featured in the world's top magazines and fashion award ceremonies. Although Shudu might be his most well-known, Wilson has made 6 more virtual models, 2 of which include Margot and Ji. Together, they make up the Digitals, the world's first all-digital modeling agency launched by Wilson. The world of avatars, 3D models, virtual reality, and social media influencers is not going away anytime soon. In fact, one may argue that the demand will increase. During the pandemic, the word virtual has become synonymous with many of our daily activities, and the technology driving the virtual world has increased tremendously. Businesses will have to continue to find new ways of capturing their target audience, whether it is fashion, food, electronics, or travel. Businesses have to become more creative in the tools that they use to gain not only the attention of potential buyers, but also their trust. The Vitra campus, as stated on their website, contains buildings by some of the world's leading architects, and the Vitra Design Museum, with its exhibitions on design and architecture, design archives, and a comprehensive furniture collection, are all part of Vitra. They inspire visitors and create an atmosphere in which innovation flourishes. In 2016, Camper and Vitra joined forces to provide a concept shopping model where buyers can shop for themselves by scanning their feet and allowing the computer to identify the best shoe for them. This beautiful design and layout of a store made the shopping experience very relaxing. Not bothered by sales personnel asking many questions, you, the customer, are allowed to explore on your own. And if you need assistance, there is someone there to assist you. The airline industry has suffered greatly during the pandemic, with many countries implementing flight restrictions. What then is the airline industry to do? One such example of innovative thinking by an Asian airline was to offer its online food as takeaway. They provided their most popular dishes in takeaway restaurants and kiosks. This has been very successful for them, so much so that they have expanded their services to other nearby city locations. Why is innovation important? Innovation is important because it brings new, unique solutions to meet culturally specific needs. Now let's look and see what's happening in the developing world when it comes to innovation. The shoe that grows 5 sizes. Children are notorious for quickly outgrowing clothing and shoes. Their growth spurts are especially a challenge in developing nations where money for worn or outgrown items is scarce. The shoe that grows 5 sizes is a simple concept. Adjustable shoes that children can wear for years, capable of expanding 5 sizes through a series of notches and snaps. The shoe generally fits a child's foot from age 5 to 9. This will help curb many foot injuries and in the case of soil-transmitted diseases and parasites. The Life Straw. About 783 million people, or 11% of the world's population, lack access to improved sources of drinking water. Drinking contaminated water can lead to devastating diseases and illnesses. It is estimated that every 90 seconds, a child dies from a water-related disease. Life Straw makes drinking contaminated water safer, which can be a game changer in poor regions where water access is minimal. The straw-like device uses a simple filtration system made of specially designed cloth to render water safe to drink. The life-saving dot. In rural India, thousands of women are estimated to have iodine deficiency, which has been linked to breast cancer, fibrostic breast disease, and pregnancy complications. The life-saving dot is an iodine-rich variation on a traditional bindi. It is worn between the woman's eyebrows, just like a bindi, and delivers a wearer with the recommended daily amount of iodine. The life-saving dot only costs 10 rupees or 16 cents for a packet of 30, fitting the budget of women in rural India. The Eco Cooler. In developing areas without electricity, soaring temperatures can leave huts unbearably hot. The Eco Cooler, a low-cost cooling system created from recycled plastic bottles, helps solve the issue by drawing cool air into homes. The cooler is made of halved plastic bottles on a board, which is then installed like a window. When in place, each bottle neck compresses the hot breeze, cooling it down and dropping the temperature inside a hut as much as 40 degrees Fahrenheit.
Health policy can be defined as the decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. Those goals may cover topics of financing, the delivery of healthcare, the access to care, the quality of that care. Health equity will cover health disparity as well as healthcare disparities. Those are certainly very different things. When we speak of health equity, what that really means is that everyone has a fair and just opportunity to be healthy. To get there, we have to remove the obstacles to health, such as poverty, discrimination, poor education, lack of housing, lack of just the very access to cutting-edge technology to use in healthcare systems. Health disparity, on the other hand, is really a difference in health status that is closely linked with social, economic, and environmental disadvantage. Healthcare disparity really refers to the differences in the quality of healthcare provided that are not due to access-related factors or clinical needs, preferences, and the appropriateness of the intervention. When I think of healthcare disparity and innovation, what comes to mind immediately is opioid use disorder. According to the DSM-5, opioid use disorder is defined as a problematic pattern of opioid use leading to clinically significant impairment or distress. In the United States today, we have in excess of 2 million people who are diagnosed with an opioid use disorder, and that number continues to climb in the light of COVID. In Washington, D.C., where I am located and I conduct my research, we've had 1,325 total deaths due to opioids between January 2016 and September 2020. Those were the latest figures from the coroner's office. But of more concern is the trend that we have seen in light of COVID. That number has gone up significantly. Year to date, we have 317 opioid deaths. The cases of opioid deaths now involve more than ever some fentanyl analog. It increased from 62% in 2016 to 94% year to date in 2020. 84% of all the deaths, however, due to opioid use were among blacks, with a consistent trend across the years in Washington, D.C. That's concerning to me because the deaths are going up, but the population of people of color continues to go down based on other social things that are happening. Deaths due to opioids were the most prevalent in the age group 50 to 59. 35% of those individuals who died were within that age group. And that's also very concerning because individuals are in the prime of their lives. But what is even most concerning to me as a researcher, as an educator, as an administrator, is that the lion's share of the prevalence of those deaths really occurred in three wards, wards 5, 7, and 8. 91% of all the deaths, 91%, involve some illicit fentanyl analog. Now, what happens when a patient is undertreated or not treated when they have an opioid use disorder? They experience withdrawal. Those symptoms go up significantly. Criminal activity and incarceration can indeed go up as well. The risk of exposure to HIV and hepatitis C, two very expensive diseases to treat, goes up significantly. And of course, as I mentioned prior, the risk of death goes up astronomically. As productive members of society, productivity goes down. The overall health and well-being of our citizens goes south. And that's a challenge. That's something that we do have to address. Now, treating OUD requires a biopsychosocial approach. And this is considered the gold standard. And in that approach, it includes what we call medication-assisted treatment. And one of the drugs, I would think the most prevalent, the most successful one to date, is buprenorphine. The challenge with using buprenorphine is that some patients don't respond to the FDA-approved dosing and may require higher doses. That warrants a question. That warrants an innovation question in particular. How do we address this as scientists? How do we address it as healthcare providers? How do we innovate to eliminate the disparities and save lives? Well, I say we do this through pharmacogenomics. What is pharmacogenomics? Pharmacogenomics studies how inherited genetic variation, also known as polymorphisms, impact drug response, and is a combination of pharmacology and genetics. When information gleaned from pharmacogenomic research is translated from the bench to the bedside, we refer to this as clinical pharmacogenomics. You receive one allele from your mother and one allele from your father, and the combination of the alleles makes up your genotype. Each of the alleles is associated with a particular level of functionality, and the physical presentation of your genotype is what we call the phenotype. The phenotypic presentation is of importance as we innovate in healthcare, as we innovate with pharmacogenomics. Some patients present as poor metabolizers, meaning they will not metabolize certain drugs based on particular genes very rapidly. So the drug may accumulate. Some present as intermediate metabolizers. Some present as normal or extensive metabolizers. And then we have those who present as ultra-rapid metabolizers, meaning their genetic pattern allows them to really metabolize the drugs much faster, and it clears their system without really getting to the necessary therapeutic concentration. My team and I conducted a study looking at 113 patients in Northeast Washington, D.C., who are undergoing buprenorphine-based OUD management to determine if their clinical pharmacogenomic testing for the CYP3A4 and CYP3A5 gene would impact their treatment outcomes. Just for clarification purposes, the CYP3A4 gene is where buprenorphine is metabolized, And for information purposes, a large number of pharmaceuticals on the market today is metabolized via the 3A4 gene. Our research suggests that patients with at least one copy of the 3A4 star 1B allele exhibit an accelerated rate of metabolism compared to what we call the wild type or normal, which is CYP3A4 star 1. When those patients were dosed according to pharmacogenomic guidelines, these patients do much better. They exhibit less withdrawal. Thus, they don't supplement with illicit substances to dull the effects of withdrawal. Our findings are clear that innovation surrounding pharmacogenomics should be the standard of care, and it needs to be a formidable piece in the arsenal as we guide health policy. I'm of the opinion, and I'm collecting additional real-world data to show that using pharmacogenomics as a standard of care is the way to go.
Open up your books to page 360.
Did you just look at your phone while you was in class? You played yourself.
Talking about inspirational quotes.
You gotta believe in yourself. Don't ever play yourself. The key is to make it, so make it.
Louise, can you give me an example of an inspirational quote?
Don't play yourself. The key is to make it.
And who said that?
I did. Now that's a major key alert.
Learn the real major keys to getting to college at getschool.com.
Get caught buzz driving, and you could do some hard time.
Craig, knock it off.
Sorry, Mom. It could cost you around $10,000 in fines, legal fees, and increased insurance rates. And that could set you back a few years. Buzzed, busted, and broke. Because buzz driving is drunk driving.
Hey, you.
Yeah, you. Getting that college education, what are you gonna do? Graduate and take some office job? Be like everybody else? Or will you dare do something different? Like be a teacher. You could be my teacher. You got the skills. The smarts? Yes, you. You could be the teacher I never forget. That'd be cool. Does that corporate job even have recess? What are you gonna make of yourself?
What are you gonna make of me?
This is the moment I knew. His future had no boundaries.
There are some moments only the forest can inspire. Find yours at discovertheforest.org.